Hello, my name is Valerie Everhart Hernandez. I'm a graduate student at SUNY Delhi in the Nursing Education Program. I'm going to discuss adults aged 19 to 64 with an accessible primary care provider, which is an indicator from the National Scorecard on U.S. Health System Performance as a key performance indicator. ESDIS 2013 advises that the U.S. average rate of adults with access to primary care provider is 56. The benchmark rate for this is 77. The Commonwealth Fund 2018 notes that in 2008, nearly 45% of adults did not have a routine primary care provider, or PCP, that was easily accessible via location and over the phone. Of those, 50% obtained fundamental preventive care. Sadly, this shows only slight variation from the 2002 results. Thus, this is an area of improvement that is greatly needed. With much of the population getting older, the need for PCPs increases. The proposed need for PCPs does not always take into consideration that the number of future providers is not permanent, rather than accurately taking into consideration the changing needs of society based on the population as well as other factors. Auerbach et al. 2013. In addition to this, despite the aging population, prevention must always be a priority. With this, the need for providers only increases in order to adequately provide fundamental preventive care. The results from 2002 National Scorecard released in 2006 from the Commonwealth Fund demonstrate that the U.S. rate fell from 66 to 56 in 2011, which was illustrated in a previous slide. The need for access to care and to receive primary prevention is well documented. It is very unfortunate to see this rate decrease. Obviously, it would have been optimal for it to improve, but at the very least, it should have remained the same. PRENA 2017 notes that the number of physicians is expected to rise between 2013 and 2025. It is projected that in 2025, the number of available physicians will not meet the number required, though the use of physician's assistants, or PAs, and nurse practitioners, or NPs, can lessen this imbalance. Several initiatives are underway across the nation to address this shortage of PCPs in order to increase everyone's access to primary care. For example, the Rhode Island Foundation, or RIF, has created an NP residency in order to prepare NPs to practice in areas with high rates of vulnerable populations, such as the uninsured and those with Medicaid. Another initiative of the RIF is the education of the public and local leaders on the significance of primary care. PRENA 2017. Poor education is another key factor that can be a hindrance in receiving primary care. We have all heard of patients that come in with no medical history because they have not been to the doctor in 20 years. Some of us even have family members who did not begin to receive routine care until their 40s or 50s when they became symptomatic from conditions. Efforts to increase the number of physicians entering the workforce have not been successful in addressing the PCP gap that is causing many adults to lack access to primary care. Less than 10% of medical students opt to focus on family or internal medicine in their residencies. Additionally, the number of primary care physicians that work full-time is decreasing. Furthermore, the reimbursement rates for primary care are less than optimal. Bodenheimer and Smith, 2013. This only exacerbates the problems, as physicians often rush through visits with patients in order to have a financially productive workday. Frequently, visits are scheduled for 15-minute intervals. Rabin, 2014. The Commonwealth Fund is a private foundation that measures performance indicators and sets benchmark goals for our nation's healthcare. Initiatives to achieve these goals and then measure their outcomes are put in place by agencies such as the Agency for Healthcare Research and Quality, or AHRQ, and Centers for Medicare and Medicaid Services, or CMS. Data is available to the public and promotes transparency and accountability. Achievement of these measures often indicate quality service, for example. Patients' ability to reach a primary provider by phone during normal business hours, number of patients who receive standard preventative screening exams that are appropriate for age and sex, and their ability to physically be seen by a PCP in their local area are examples of indicators that measure these outcomes. It is possible to use health policy to address the healthcare problem of lack of access to PCPs for the adults by increasing the amount of reimbursement for primary care visits, enacting loan forgiveness for providers that enter family or internal medicine, and mandating time spent with patients, as well as increasing the usage of telehealth for rural areas. It was mentioned previously that only a small percentage of new physicians entered the field of family or internal medicine. Much of this is due to the less than optimal pay when compared to specialty areas of practice and is related to decreased reimbursements. Therefore, increasing reimbursements for primary care is one solution to entice more PCPs to enter primary care. With this, the number of years of education and student debt that is required to become a physician is enormous. This results in many physicians looking to specialize in order to compensate for their years of hard work and the significant amount of debt they have to pay back. If loan forgiveness was enacted, or at least to some extent, for physicians that entered primary practice, it is likely that the gap would greatly reduce. This could also be enacted for rural areas that are underserved, encouraging providers to serve a rural area for some type of loan forgiveness. Additionally, the use of telehealth has the ability to increase access to care as it removes factors for those who are unable to drive, live in rural areas, or otherwise would not have the time to visit a primary care provider. These policies would be best served if enacted on both local and national levels. I request that the Congressional Committee enact policies that support primary care. Examples of these were previously mentioned and include increasing reimbursement for primary care, offering loan forgiveness for PCPs that enter primary care, and increasing the availability and usage of telehealth. Thank you.